Hi, I'm Alison Martin, and I'll be covering obsessive compulsive disorder. The learning objectives for this are to describe the symptoms and possible treatments associated with obsessive compulsive disorder, as well as to understand the biological and environmental factors that contribute to this disorder. A brief overview of obsessive compulsive disorder, also known as OCD, is that it's a neuropsychiatric disorder that's characterized by persistent obsessions and compulsions. Its prevalence in both the US and internationally are about 1 to 2%, and females are slightly more likely than males to be diagnosed with OCD. Symptoms tend to appear in young adulthood, but they can appear in the early childhood years, sometimes as early as 5 to 9 years old. And another thing that's really important to recognize is the fact that OCD has been very misrepresented by our media and just our culture in general. It's not a disorder that's just about being clean. It goes a lot deeper than that, and it can manifest itself in many different ways. So it's kind of important to remove yourself from these biases so as to understand the disorder fully. The main symptoms of OCD include obsessions and compulsions. Obsessions are unwanted thoughts or ideas that preoccupy one's mind, and compulsions are behaviors that one feels they must perform even if they do not want to. These kind of create a vicious cycle that go together. Obsessions create overwhelming anxiety that can only be relieved by performing the compulsion, which then just leads the patient to obsess over something, develop anxiety over it, and then perform compulsions to rid of that anxiety before it inevitably returns again. And a very commonly seen obsession with OCD that's widely known is a fear of contamination. This might result in a compulsion of excessive hand washing, but this is not the only way that OCD can manifest itself. For example, it can also manifest itself with an obsession of a fear of forgetting. Forgetting to turn off the stove, forgetting to lock your door. This might manifest itself in a way of checking that the door is locked dozens of times, in just an hour, leaving work, but then coming back early to check that the door is locked. Another example of an obsession could be a fear of harming others. This might result in repetitively checking on others. There's an interesting case of a man who would fear that he would hit a pedestrian while he was driving to work, and this would result in him driving his route to work several times, sometimes for hours on end, checking to make sure that he didn't hit any pedestrians. The physiology behind OCD is not 100% understood, but it's relatively agreed upon that there are mechanisms that result from abnormalities in the CSTC pathway structure. This structure is a neural circuit that connects the cortex, striatum, and the thalamus, and this pathway is associated with inhibition of impulsive behavior, selection of actions, modulation of motor activity, and attentional allocation. Malfunctioning neural circuits containing the orbital frontal cortex, anterior cingulate cortex, caudate, and anterior thalamus are also implicated in this disorder. And while there's no one mechanism that's 100% agreed upon, it does seem to be widely agreed upon that the basal ganglia is very much involved in OCD. There are both genetic and environmental causes in OCD. For genetic causes, we can see support for this in the fact that there's greater concordance in monozygotic than in dizygotic twins. And there's also been research regarding genes implicated in this disorder, such as the SLC1A1 and the GRIN2B genes. But the associations for this are not extremely strong, only convincing enough to promote more research in this field. And there's also abnormalities in the serotonin 1B receptor. This is supported by pharmacological and genetic association studies, as well as a study regarding mice that demonstrated that the administration of an agonist for this receptor led to OCD-related behaviors in mice, and then these behaviors were then able to be treated by the use of an SSRI. And a graph for this can be seen to the right here, where you can see that the experimental group displayed more OCD-related behaviors than the control group did. Environmental causes for OCD are also not 100% solidified, but it is very much agreed upon that stress, trauma, and parenting styles all contribute to the development of OCD, as well as brain damage can also contribute to this disorder. This can be seen with birth trauma, encephalitis, head trauma. There's cases of patients who experienced head trauma and then soon after developed symptoms of OCD. And then another interesting environmental factor that plays into OCD is strep can actually trigger an autoimmune disease that attacks brain tissue. There was an MRI study of 34 children with strep-associated tics, or OCD, and this imaging study showed that there was an increased basal ganglia size, and this was attributed to an autoimmune inflammation of this region as a result of the immune system attacking the basal ganglia tissue, and thus causing OCD symptoms. The first line of treatment to OCD is typically cognitive behavioral therapy, or CBT, as this helps the patient to kind of break down their problems and develop healthy coping skills instead of resorting to performing compulsions. Another common therapy is exposure and response prevention therapy. This encourages the patient to face their obsessive thoughts without countering them with compulsions, so it kind of breaks that vicious cycle of OCD. There are also pharmacological treatments for OCD, the most common of which would be SSRIs. And if none of the above treatments work, it's possible that the patient might move on to other treatments such as deep brain stimulation or transcranial magnetic stimulation. And here are my references, and thank you so much for watching.